Hello, my name is Dr. Andrea Watson, and we are a family medicine clinic. We see ages 5 and up, and we see, again, anything that would involve family medicine, so chronic conditions, and we see obesity, weight loss management. We also do hormone therapy, which I am so excited about. Hormone therapy, we call it HRT, Hormone Replacement Therapy. This is amazing because this is a progression into getting patients feeling better on a daily basis. Common signs that you may have a hormone deficiency, most common is fatigue. Patients come in and they're just so tired, just exhausted. They can't really pinpoint why they're tired because, again, they've probably had blood work done and they've had their B12 checked and their vitamin D's checked, and weight gain, irritability, mood swings, decreased libido, especially in men. Also, there is decreased muscle mass, hair loss. So there's many different factors that can affect patients. Some may have all of those. Some may only have one or two. At the end of the day, though, if it bothers them enough, they will come in and present and want to have some treatment done or testing. So with decreased libido, men and women, they do present differently. So for men, that's testosterone, and for women, that is estrogen, progesterone, and testosterone. And that can always be addressed if hormone deficiency is the culprit. The process is going to be when patients come in for initial consultation. So we do blood work to do an evaluation. Blood work includes, again, estrogen, progesterone, testosterone. Those are big ones, but also cortisol. We want to check B12 levels and vitamin D and thyroid levels, because at the end of the day, they all make a difference and they all need to be replenished so the patient can feel and be their best. And so let me talk about pellets a little bit before I even get to the Avexapil method. Pellets are amazing because they're bioidentical, meaning that they are molecularly identical to what the own body naturally makes. This is really important because this then will operate more as your own natural hormones would respond and behave and act in your own body. And so Avexapil is a bioidentical pellet. We want to care about the entire process, and we use an algorithm so that way the patient is getting exactly what they need when they receive a pellet, meaning that all of that blood work that we did, everything is accounted for. And that is the beauty of the Avexapil method. There's an algorithm that does the calculation for us. And another positive about the Avexapil method is they really don't have any pain. And they lay beautifully in the fatty tissue. You're not supposed to feel them, okay? The healing time from the time you receive your pellet is 5 days. So we request that they don't do any significant exertion or exacerbations of, for instance, going to the gym. After that, they are good to go. What I would say to someone who does have a lot of symptoms mentioned and have been told that, yes, it likely is your hormones, but that's just the way it is. You know, you're getting older. You just have to go through this rough patch. We don't know how long it's going to last, but at some point you may feel better. I really feel like that is unacceptable. It all starts in your 30s and 40s, 50s, bringing your hormones to an acceptable level. And the vascular system, the skin, all those depend on well-balanced hormones in the body. And so we want the patient to be healthy on the inside, but also the outside, and to feel it. A good question the patients ask me in the office is, will hormone replacement therapy cause cancer, particularly breast cancer or prostate cancer? But the question lies really with their history. And this is why it's so important to get a great history intake before even considering someone is a candidate. You have to look at everything from, their family history, their own personal history, particularly breast cancer, genetics, inflammation, diabetes. There's so many things that plays a role in risk of breast cancer. And so you take all of that and you have to make sure that the patient is a great candidate. If the patient can pass that initial intake, then we move to the next step. We know back in the early 2000s, when there was a women's health initiative that showed, I would say, a peak in breast cancer, those were very synthetic hormones that really no one should be on. So these are bioidentical, and that's what sets apart this program, this hormone regimen that we're on, as natural as possible, healthy as possible, but yet still reach the benefit that we want and more. I get so excited just seeing their expressions and their stories about how they got their life back. And this is what they tell me: I feel like I have my life back. And I don't think anybody knows what that means until they've been there to a place where they've been chronically tired for so long. Feeling better is everything. Most, if not all, say energy. Energy was a big driving force for me. I feel so much better. So that's beautiful. I love stories like that. It just encourages me to continue on and put more pellets in people.